This is Talk.
Hello there and a good evening to you. This is Talk, and just a reminder at the top of the hour, if you've ever wondered what my relatives look like, my brother will be here to go through the newspapers, not because he's my brother, although he did say yes, but because he's also a broadcaster and an author, so he's going to be going through the papers for you. So that's coming up at the top of the hour. Now though, emergency dental care. Let's be honest, most of us wait until it's an emergency, and if you're telling me that you don't, then we can't be friends, I don't think, because most people do, don't they? Anyway, I do. I'm pretty good now, but I used to. Health Watch England, the patient watchdog, has been looking into how to access urgent dental care and how it's been an increasing challenge for people forced to travel up to 100 miles for emergency dental care to see a dentist. They're forced to go private or even travel abroad or end up pulling their own teeth. Ouch. New government proposals will come into force in April that aim to help with access to dental emergency services, with dentists in England to be paid more to make sure patients have easier access to emergency appointments. The idea is to incentivise those dentists who stop their NHS-funded work. However, experts are not convinced this will improve dental care. Well, joining me now to discuss this is Dr. Deepak Aulak, dentist and co-founder of the Toothfairy app. A very good evening to you, Deepak. Thank you very much indeed for joining me. Emergency dental care, why is that in such a state? Why is dental care in such a state at the moment?
Yeah, essentially, where you don't have to go far to see, we're in the middle of a kind of a national dental crisis right now, and you can pinpoint it pretty much to the 3 A's. You know, dentistry is not affordable, it's not accessible, and it's definitely not available either. So what we're seeing is a mass exodus of dentists from the NHS, and the government's starting to take note. You'll see some releases today that the tone of the government's slowly changing, that the system is just not workable, and yes, dentists, we welcome such a position.
An interesting article that I read earlier on today saying in 2025, the state of your teeth says more about your class than your accent ever could. So you can define poverty pretty much by looking at the state of somebody's teeth. Would you agree with that?
It could be an unfavorable truth. Unfortunately, what we're seeing here is certain areas of the country have been decimated. You know, certain areas that are more working class, the Black Country up north, areas near the coast. These are the individuals, like you said, having to travel hundreds of miles, and it is a shame. People are having to do DIY dentistry. We're seeing a rise of that even here at Toothfairy. We're seeing people trying to use their garden tools to do some DIY.
Oh, you're kidding! Their garden tools.
It is one of those unfortunate situations, and it's I think some stats have come out just today saying that 4 in 10 people, adults themselves, have visible decay. It's up 28% since 2009. It really is a harrowing kind of situation right now.
I mean, I suppose if there's no alternative, I mean, I was saying earlier on, I don't believe there is any pain worse than dental pain. If you've got an abscess or because you just can't get away from it, and often normal painkillers just don't even touch the side. So how desperate is it out there? What stories are you hearing about, that when people are at that point where you could literally lose your mind from the pain?
Yeah, definitely. So I think 1 in 3 of all paracetamol overdoses at some A&Es, I think Nottingham A&E released some stats many years ago, were due to dental pain.
I'm not surprised. I'm really not.
And as you said, there's a lot of DIY dentistry going up. We're seeing a 45% increase of people visiting A&E due to dental problems. That's costing a taxpayer over £18 million at a time where NHS services are already stretched. And like you said, we're seeing even people that have free NHS care, those that are pregnant, those on low income, still cannot access a dentist. So those are being really marginalised. And that's the situation we're really seeing. Dentists are really asking the government to look at that model. The NHS model is just not workable. And like we said, that's why there's a mass exodus. That's why people are really leaving the system to try and offer the patients a better alternative. But there is a financial constraint for many patients already.
I mean, private dentistry as well, in the last couple of years, just seems to have gone through the roof. And when I say private dentistry, I'm not talking about the posh dentists. I'm talking about, you know, my local dentist is who I have to go privately to because I haven't got an NHS dentist around me. It is extraordinarily expensive. It is absolutely breathtaking how much you're out there. You're just giving them £1,000 for a basic, you know, filling and a, you know, whatever it is you're having done.
You know, you're seeing those in certain areas. And look, if you look at the World Health Organization, they're saying pretty much all, if not many, dental diseases are preventable. But this system just doesn't allow people to get in earlier. You know, every root canal, every crown at one point was preventable. And as dentists, we're encouraging people to say, look, come in and see us earlier. But obviously, there's these big barriers preventing them. Private dentistry is trying to fix that, you know, lower examination costs, doing kind of payment plans so people can do, you know, monthly plans to see that 2 or 3 checkups a year. It is really difficult. And it seems the NHS is moving now more towards an emergency service. You know, the current plans today are keeping dentists into firefighters, you know, urgent care firefighters rather than important members of the community. You know, 8% of all undiagnosed diabetes are detected by dentists. It's moving us away from that important job and more into getting people out of pain when really we want to avoid that early on.
Yeah, I mean, again, I was saying earlier that, you know, you might chip a tooth, right, for example, and you think, no, I can't afford, it's something you can put off, right? People always think, oh, I'll just put that off. As I was also saying, dental pain never gets better, right? It's not one of those things you can go, ouch, that'll be all right, it'll fix itself. It never does. It always goes on to get worse. But a lot of people don't, it's something they put off, it's something they can't afford. Maybe they've got to travel vast distances to go towards. So as you're saying, the NHS dentistry then does become that emergency when you're in agony and you can't go anywhere else and you phone 111.
Exactly. So we're seeing trends in more people calling 111, more people going to a GP, more people going to A&E. But the problem is the system is not organized to deliver such good care. And dentists, if you compare us to Italy, you know, Germany, even France, we've got less dentists per 10,000 capita compared to all those countries, which is really, really scary. I mean, we're seeing people now go back to the 90s. The dental state is matching, what was it, 1998, 1999. Wow. Those were the last time we saw 4 in 10 adults have dental decay. So the government really needs to look at the way that the British Dental Association, the dentists, are really trying to ask the government to say, look, that model that was built in the 2000s just doesn't work for this current population. Let's get people earlier into a dentist. Let's prevent dental issues. Let's not wait for that root canal or that crown. And that's what it seems to be, more about urgent care appointments and less about prevention, really. That seems to be taking a back seat.
Do you know why that pharmacists won't give antibiotics for dental pain?
Dentistry is in a really interesting place. Again, why there is some pressures on many dentists is that litigation against dentists is incredibly high. So unlike other areas of healthcare where if that healthcare practitioner gets in trouble, everybody bands together and tries to find a solution. Dentists are pretty much left on their own. So what you're now finding is a very litigious environment. People are unfortunately in a lot of pain, a lot of emotions going around. So pharmacists at some points just cannot seem to just prescribe antibiotics because that might not be the best solution. It sometimes needs a drill on a tooth. It sometimes needs more sort of better intervention. And if something goes wrong, those pharmacists are in quite a tricky position.
I just wish they would. It's always so handy. Dr. Deepak Orlak, thank you very much indeed. Remind me again about your app, Toothfairy.
Toothfairy app, yeah, you can find us online for any emergencies or any urgent assistance. Yeah, we're dentists trained in the NHS looking to kind of relieve some of the pressures that it's experiencing.
So if you're having a dental emergency, you can go on to Toothfairy.
Exactly. So, and speak to a real dentist. We'll try and help you. And even if you've just got healthy teeth and you're looking to just smile better, this dentist is there to assist you.
Wow. I've got that written down. Thank you very much indeed for that. Dr. Deepak Orlak, dentist and co-founder of the app, Toothfairy. Stay where you are because coming up at the top of the hour,